appendicitis from chemotherapy, or any irritation in the GI tract, including colitis. Remember, the powdered aloe vera can be a very potent laxative and works really well to treat constipation. Number 2, ginger for nausea and vomiting from pregnancy, from chemotherapy, or just any nausea in general. As a cardiologist, I see people who take many medications. One of the common ones is antacids. And patients ask me all the time, Dr. G, can I get off the antacid? Well, we know today that 25 million Americans suffer from what we call heartburn. Many of my patients want to put aside the prescription medications, and they say, give me something natural for my heartburn. And one of my favorite herbal remedies in this situation to treat heartburn is licorice. But I want you to do 2 things before you decide to take licorice for your heartburn. Remember, food first. So number 1, stop heartburn-causing foods. Let's review what they are. Cooked tomato sauce. This is a big one, very acidic. Excess caffeine, especially coffee. So don't be drinking 7 cups of coffee a day and come in and tell me you have heartburn. Chocolate, soda, and any carbonated beverage, even carbonated water, can cause heartburn. Some of the more obvious ones, fried foods, alcohol, foods very high in fat, your beef, your pork, and your lamb, and full-fat dairy. So food first, clean out the diet. Number 2, before you look for a supplement for your heartburn, if this is a problem for you quite a bit, I want you to go to your physician. And I want you to ask them to test you for a bacteria that causes heartburn called Helicobacter pylori. Remember, we talked about this bacteria as a cause of chronic inflammation. And after you do those 2, change your diet and check your blood for Helicobacter pylori, then you can think about taking licorice. There is one important thing you need to know about licorice. Licorice raises blood pressure. But the form of licorice that I want you to take will be labeled this way, DGL. This is the form of licorice that does not raise your blood pressure. So if you suffer from heartburn routinely, go and buy the licorice with the DGL on the label and take 600 to 800 milligrams about 20 minutes before your meal. Now, I've tried this. It tastes pretty good. So you just chew on it 20 minutes before your meal, and you could do this for up to 6 weeks. Or you may just want to take it when needed, at which point you can take anywhere from 300 to 400 milligrams as needed. Remember, other forms of licorice can increase blood pressure and lower your potassium. A lot of people don't realize a common cause of high blood pressure is, guess what? Black licorice. Sometimes we just have patients stop their black licorice and even their black jelly beans, and their blood pressure goes down. The last superstar we will talk about for the GI tract is peppermint. Peppermint is a tried and true herbal remedy for irritable bowel syndrome. Now, I have mentioned irritable bowel syndrome before. This is a very common disorder which affects the colon, the intestine, the large colon. Frequently, people will say they have cramping, pain, bloating, gas, diarrhea, and even constipation. These are all signs of irritable bowel syndrome. We already talked about the elimination diet and how it can help irritable bowel syndrome. But if you needed a supplement or an herbal remedy, peppermint is the way to go. Research has shown two mechanisms for how peppermint works. The main one is peppermint slows down the GI tract. It slows down the movement of food from the oral cavity all the way down to the colon. And it inhibits smooth muscle cell contraction. So think about this. If the colon is not contracting and it's not spasming, you have less pain. This helps the pain and the bloating that we frequently see with irritable bowel syndrome. An important caveat about peppermint. Make sure you buy your peppermint as enteric-coated tablets 3 times a day, because if you take peppermint that's not enteric-coated, it will cause heartburn. Well, now we've evaluated some herbs for the gastrointestinal tract. Let's take a look at some for the urogenital tract. And let's pick a problem women frequently face and one that men frequently face: urinary tract infections and prostate enlargement. In 2009, a study was published that looked at cranberry. And the focus of the study was whether or not cranberry would reduce the frequency of recurrent urinary tract infections in women. And what they found was that those women who drank 4 ounces 2 times a day of cranberry, or took extracts, tablets of cranberry, 400 to 800 milligrams daily, had a reduction in their urinary tract infections. You may remember when we talked about the healing properties of food that I mentioned that cranberry actually is a natural antibiotic, and it helps to prevent the bacteria from adhering to the lining of the bladder wall. So, if you suffer from recurrent urinary tract infections, you may want to try cranberry. 4 ounces 2 times a day if you like the juice, but please make it unsweetened. I don't want you to get the extra sugar. And especially if you're diabetic, use the cranberry extract, 400 to 800 milligrams per day. What about for the guys? A common problem men come into my office with is waking up at night to urinate. Some men wake up 3, 4, or 5 times a night. Needless to say, that doesn't make for a good night's sleep. The minute I hear that, the first thing I'm thinking is, how big is his prostate? The second symptom men complain about is that their urinary stream is slow or sluggish, not forceful. So these are signs of what we call prostate enlargement or prostate hypertrophy. So what might we do in this situation? Well, the most studied herbal for prostate enlargement is saw palmetto. Research has shown that saw palmetto significantly improves the symptoms I just described in people who have mild to moderate enlargement of their prostate gland. That means they get up less frequently at night and their urinary stream is stronger. Saw palmetto has not been shown to make big improvements in people with severe prostate symptoms. But in mild to moderate prostate enlargement, it is as good as the pharmaceutical called Proscar. In fact, Proscar has the active ingredients of the botanical saw palmetto. If you decide you want to try saw palmetto, you need to look at the label of the bottle. 160 milligrams 2 times a day. Remember, if you're not certain if you have the right product, check the consumerlab.com website, as we discussed in our previous lecture, because not all products are made the same. So how does this work in real practice? What happens when someone comes into my office with a medical problem and they say, Dr. G, I want to go on supplements. How might I approach this person? What kind of questions would I ask before just putting someone on a supplement regimen? Let's take a real person. Sally came to see me because she had a history of migraine headaches. She's 36 years old. She told me that she has a family history of migraine headaches as well. But she has suffered from migraines since she was age 14. Sally told me that her headaches occur 4 to 10 times per month. And when they occur, they are debilitating. She has to go to bed and take multiple medications. She's noticed some triggers for her migraines. She says they are worse when she drinks red wine, when she eats cheese, and around the time of her menstrual cycle. By the time she came to see me, she had seen many physicians. She was on the best that Western medicine has to offer. She had the best drugs available to her. Her laboratory tests looked pretty good, nothing was abnormal, and she even had a brain MRI, which was normal. They could not find a reason for her migraine headaches. So I say to Sally, let's start with food first. Obviously, we want to remove the triggers for your migraines. She already identified red wine and cheese. But given the number of headaches that Sally has, I would probably have her do an elimination diet. Because as we have seen in a previous lecture, the elimination diet can really impact migraine headaches. At a minimum, Sally needs to be on an anti-inflammatory diet. So we always go with the food first, whole foods, off of the carbohydrates, off the white stuff, the foods high in sugar. And hopefully, in Sally's case, I can convince her to try the elimination diet. But when I saw Sally, she was really eager to have a supplement. So I have to think about the research on all of the supplements as they relate to inflammation, and in this case specifically, as they relate to migraine headache. And one of the first supplements I picked for Sally is called Butterbur. Now, Butterbur has been around for a long time. It's a traditional European herb that has been used for years for allergies. But more recently, Butterbur has been shown to significantly decrease the amount of migraine headaches. So I talked to Sally about a placebo-controlled study in which people were given 150 milligrams of Butterbur over a 4-month period. And I show her that they had a statistically significant reduction in their migraine headaches in comparison to a placebo group. I also explained to Sally that Butterbur can have liver toxicity. That's why it's very important that if together we decide this is the right herbal remedy for her, that we only use the herbal remedy that was studied. And that has a different name, Petadolex. So when we pick our herbs, it's important to say, what herb was used in the study What parts of the plant? How is it prepared so that we have the right formula for the right situation? So I recommended Butterbur for Sally in the form of Pentadolax. I can also tell Sally that 16 randomized controlled trials were reviewed that looked at how well Butterbur did next to prescription medications. And guess what? Prescription medications like Inderal, also called propranolol, and Topamax were just about as good as Butterbur. Said another way, Butterbur did as good as the prescription medications in reducing the number of migraine headaches. So now we have Sally giving up the triggers, the red wine and the cheese. She's thinking about the elimination diet, and we're starting to recommend supplements. So we have one that has excellent evidence. What else would I recommend at this time? Although they are not herbal remedies, I want to give her all the best that vitamins, supplements, and herbs have to offer. Number one would be magnesium. Studies have shown a 42% reduction in headaches taking just 300 to 400 milligrams of magnesium per day. I will say it throughout this course. Magnesium is great because it softens the stool. So if someone has constipation, this is an added benefit of magnesium. But if the stool gets too soft, I tell my patients, you have to cut the magnesium back. There is equally strong evidence for a B vitamin, riboflavin, 400 milligrams per day. So now I can recommend to Sally a couple of things. Butterbur, 150 milligrams in the form of Pentadolax, magnesium, 300 to 400 milligrams per day, and riboflavin, 400 milligrams per day. And there are a few more. We've already talked about the power of omega-3s. Omega-3s are anti-inflammatory, and omega-3 fish oil is anti-inflammatory. So I will have Sally take 2 to 4 grams per day. In addition, one other supplement has to be mentioned because it statistically reduces migraine headaches, and that's CoQ10, 300 milligrams per day. So now we have a whole supplement, vitamin, herbal formula that we can give Sally. But remember, Sally is a young woman. One of the key questions I would ask her before prescribing any herbal remedies or even supplements is, does she plan to get pregnant? Because if she plans to get pregnant, then I can only use those vitamins, herbs, or supplements that have been proven 100% safe in pregnancy. Remember, I talked about some supplements that were okay during pregnancy, but not all of them are. So in this case, I would say to Sally, I feel more comfortable giving you the magnesium, the omega-3 fish oil, and a low dose of the riboflavin, because those are the safest choices in case you decide to have a baby. As we have seen, herbs are powerful medicine. And because they are powerful medicine, we must be aware of their potential side effects. And equally as important, herb-drug interactions. Because what I see in my practice is people come in with a shopping bag of vitamin, herbs, and supplements, and a shopping bag of pharmaceutical therapies. And we need to look at how those two are interacting together. St. John's wort is a perfect example of this. Most people know that St. John's wort helps mild to moderate depression. People go and buy it every day for exactly this reason. It is a great herbal remedy in this situation, and we will talk about that in a later lecture. But take a look at what St. John's wort is capable of doing. If you're taking a medication like a birth control pill, or a heart medicine like digoxin, or a blood thinner like Coumadin, this is just a short list. St. John's wort can decrease the potency of the medications. Even medicines like cyclosporin, used for transplants, heart transplants, liver transplants, will be reduced if we add St. John's wort. Other medications will increase in their potency. Alcohol is amplified in the body when we take St. John's wort. It is very important to be aware of herb-drug interactions, and there are 4 categories of prescription medications that I want you to pay particular attention to. These are blood thinners like Coumadin and souped-up aspirins like Plavix and Effient, sedatives, things that relax us, put us to sleep, what we call benzodiazepines, things like Valium, Xanax, antidepressants, and diabetes medicine. These 4 categories are the most common pharmaceutical drugs that we see having herb-drug interactions. If you notice that you're on one of these or in this category, please talk to your physician before starting any natural remedies. And you can always get on your computer and go to the naturaldatabase.com website, and you can read all about herb, vitamin, and supplement interactions with pharmaceutical therapies, or you can go on the FDA website, FDA MedWatch. It's fda.gov/MedWatch for more information. So, in closing, I want to leave you with 3 important points. First, most pharmaceutical drugs come from botanicals, so herbal medicine is not alternative medicine. We have seen that herbs are powerful medicine and that they can be, when used properly, have a profound effect on our health, but they must be used in the right formulations and in the right doses. And when used in this way, they can be incredibly effective in treating common everyday ailments and even more challenging chronic disease.